I'm Dr. Mindy Pelz, and I want to talk to you today about a subject that I'm incredibly passionate about. It's teen anxiety and the pressures that our teens are going through right now as they navigate the middle school years and the high school years. What I'm seeing, by the way, I have 2 teenage kids. I have literally been in the trenches with teenagers for the last 6, 7 years, and I am blown away at the nutritional deficiencies that teenagers are experiencing and the toxic brains that teenagers are dealing with is really, truly at an all-time high. So the presentation I'm going to give you over the next half an hour or so was a presentation that I actually gave to my patient base. Whenever I see an issue in my community that people are struggling with, I always come at it from a nutritional standpoint and think, how can we help these people? And with this particular subject, more than any other subject that I've seen, I think it's incredibly important that there's a paradigm shift. Because what's happening right now, whether you're aware of it or not, is that the suicide rate amongst teens is at an all-time high. So like right now, they're saying that 25% of teens are feeling anxiety, they're feeling depression, and that they're either turning towards drugs, like Prozac or more alternative drugs, or they have suicidal thoughts. There's a really interesting study, or maybe not so interesting, but alarming study that was done out of the LA school district, where they said in the last 3 years that their documented suicide rates have gone from 250 a year to 5,000 a year. And when you look at teens in general and you sit down with them and you talk to them, you're just going to see that they are ill-equipped to handle the pressures and the stress and the strain that they're going over, or that's being handed to them now more than ever. In fact, there was a study done showing that 59% of all teenagers between 13 to 17 feel like they are ill-equipped to manage the stress loads that they've been under. And what I find so alarming when I sit and I talk to my friends and I talk to other families is that really for these teens, we have 2 solutions. We have the drug solution, which, as most of you know, has its downfalls. Prozac alone has been known to increase suicidal thoughts and homicidal thoughts. If you go and actually Google the side effects of Prozac, it's suicidal and homicidal thoughts. So obviously that can't be a solution. And then the other interesting solution that we are seeing so much of is that people are sending their teens to recovery centers. And it seems so dramatic. On a personal level, my practice is in Silicon Valley. There's a lot of stress going on in that area, and I have personal friends whose kids became so suicidal that their only choice was sophomore and junior year was really to get them out of the environment and put them into a recovery center. And so from my perspective, I was like, we have to come up with more strategies. As practitioners, we have to reach out to these people and give them other solutions other than just drugs and recovery centers. And one of the conversations I've been having with other parents is that there's a lot of blame being placed. Where do we look at who's to blame? I hear a lot of people saying it's social media. And yeah, I would agree. Social media definitely has a place in it. I also think we have to look at school pressure. I have an 18-year-old. She's going to launch off to college next year. And that whole process of college applications is insane. And it is all about judgment and rejection. And it's really hard for a teenage brain to go through that. There's bullying that happens on social media as well. So we've got to look at all of these factors when we're working with these people, working with these families. But what I like to turn the conversation to is really the environment that our children are growing up in. So when a family comes to me with any kind of depression, anxiety, lack of focus with the middle school age or the high school age, what I really work on expressing to them is that, first off, the environment your child is growing up in right now is totally different than the environment you and I grew up in. And so we've got to look at the environment as a whole. And when you look at today's environment, what I think is so important for people to realize is that every species on the planet has a very specific need and a very specific environment it needs to have in order to thrive. For example, I think the animal world gives us a ton of reflection as to how environment impacts behavior and health. For example, the cheetah. The cheetah, in order to survive and to live, has to actually run. It's one of the fastest animals on the planet. In fact, I recently heard that the cheetah can run as fast and go as fast as the high-end Teslas. It has that capability in its body. And one of the things that it absolutely needs to survive is it needs to run to attack its prey. So when it goes to attack its prey and it runs, that combination is what it will allow it to survive. So it is one of the most difficult animals to keep in captivity. So in captivity, what they do is they feed it cow meat. In the wild, it's chasing antelopes. So it's a very difficult animal to keep alive in captivity because its environment is so different. Same thing is happening for vultures. There's a really interesting story about vultures right now that they're one of the quickest animals to become endangered. And here's the reason why, is that they end up, in Nepal specifically is where we're getting some information out about vultures, is that they're feeding on meat, because they go in after the kill, right? And they're feeding on meat that is packed with antibiotics. And so what's happening is these vultures are dying. So in Nepal, what they've done is they've created what they call these vulture restaurants, where they quarantine an area where animals that are dying are free of toxins so that the vultures can live. And if you've ever studied anything that Jane Goodall's done around chimpanzees, she taught us that these amazing creatures have this most loving and expressive and incredible behaviors when they're in the right environment. And when we take chimpanzees and we put them into a cage and we put them in the zoo, one of the things that we know is that they start to lose their hair, they become withdrawn, and their whole behavior starts to change. So I always tell patients, when you go to the zoo, when you look at a koala bear, that koala bear is often quarantined away from all other activity. And the reason for that is because it needs sleep 23 hours a day, and it needs eucalyptus leaves. So if you put that koala bear in a polar bear cage or a polar bear area where there's a lot of activity, there's no eucalyptus leaves, there's no water, or there's a ton of water, it wouldn't live. So I tell you all of that to really give you a paradigm shift that I want you to go out and tell other parents, and that's that our kids today are not living in an environment that is allowing their brains to develop in a healthy way. They're doing things like this, where they're on cell phones all day long with input coming in constantly. They're eating the wrong foods. They're eating fake foods and high inflammatory foods. They're not getting enough sleep. I know with my oldest child, sleep was a big issue. There's demands of homework, and their demands at school become so great that something has to give, and oftentimes sleep is the main thing that will give. And then, like I said, I just went through this process with my daughter. The process to get into university now is one of the worst I've ever seen. The pressure that these kids are under, and the level in which you have to perform to even get into school right now is at an all-time high. So what I think before I launch into nutrition and detoxing, what I want you to understand and what I want you to go out and teach others is that this environment our children are growing up in is massively toxic. And we have to come at this from an environmental change. We need to change the environment as much as we can. And that's where nutrition and detox just shines. And so when I go and I work with a family, when I'm out talking to my community, I really like to express to people that the growing brain has some very, very specific needs. And there are about 5 different things that it needs in order for it to think right, in order for it to handle stress. You have to have good nutrition going in there, or the stress will be magnified, and the ability to handle it will be magnified, and the reaction to stress will be magnified. So what I want to do is go through 4 major things that the growing brain needs, and then I want to go through some ancient healing strategies that I teach my patients that they can apply on a daily basis to make sure that they're working to change this environment. And some of this stuff you guys may know, and some of it hopefully will be brand new. And what I love about the systemic products is that they have made this really easy for us. Those of you that have teens know it's really hard to get them to eat well. I have a rule in my family that in our house, we eat one way, and I'm not gonna follow my kids around. Both of them drive now. Like, I'm not gonna follow them around to see where they're eating, but I'm gonna make sure that in my house, they're eating one way, and I'm gonna make sure that they're getting proper supplementation, because that's the one thing that I can really control in our environment. So let's start off with fat. Most of you hopefully know that 60% of the brain is made up of fat, and that you've got to feed the brain fat in order for it to work properly. So the first strategy that I teach families is that what good fat is and what bad fat is. Now, for a lot of you guys, you might think, oh, well, that seems really simple. But when you stop to think about it, it's actually not as simple as it appears. So I have to take it one step further with them. And one of the things that I do is I literally show them products. So I will go and say, look, when I'm standing at the potato chip aisle at my grocery store, one of the number one things I look for is what oils are in those potato chips. That's a really easy change that they can make. So, and what I often tell my patients is if I came into your house at night and I changed all your fats, you probably wouldn't notice much of a difference. In our household, every weekend, we tend to have a pack of teens hanging out. And I feed them all, the potato chips they pull from our pantry, they all have these good fats in them. And these kids don't know. They have no idea that what we serve is different than what they're getting at home. So I think that fats are actually one of the easiest things that we can start to implement to get people to start to change that so that we can get good fat to the brain and we can start to lower some inflammation. So make sure that you're showing them what I call lateral changes. The second thing I do in the fat category is I really emphasize good fats that they can add in. I think that it's really hard for a parent when you show up as a practitioner and you say, you gotta take this out, you gotta take this out, you gotta take this out. It becomes overwhelming. And anything that's overwhelming people just won't do it. So what I do is show them how they can make these lateral changes, but then I work to teach them how to add things in, like organic olive oil, non-rancid olive oil. So I literally, this is from many of these products are actually from my cupboard, and I show them, I'll give them a picture. Words sometimes, especially if you're teaching a parent who's overwhelmed with an anxious child, it just can fall on deaf ears. So you need to make sure that you actually show them what that looks like. So I show them, here's the organic olive oil I got at my farmer's market. Here's brain octane and I show them how I put brain octane into my salad dressings so that my kids are getting it when we're eating a salad. I show them nut butters and what kind of nuts what's the difference between dry roasted and raw. So that level of education for a lot of these families is so incredibly necessary. Now, again, like I said before, if you have teens at home, if you have a busy family, nutrition, of course, is the foundation, but I am so grateful for the amazing products that Systemic has, because I can just get these products into my kids literally as we're running out the door to soccer practice. So the oils that I use from Systemic, my absolute favorite are Vista 1 and Vista 2. Even though my kids are teens, I really like the liquid. I can put it in water. My son, which is so fascinating to me, but you guys might have experienced this with your kids, he's almost 16 years old, and till about 6 months ago, he wouldn't swallow any pills. So I would just put some Vista 1 and 2 in a glass of water and have him just drink it. And easy to taste, easy to get down. If your patients have littler kids, kids that are really can't do a pill, these drops are amazing. I've also found Brainy Play, and you'll see as I show you a teenage detox that I've been using with my teenage kids. Brainy Play is a really great product to get in. Not only really helpful for getting the right essential fatty acids to the brain, but easy taste-wise. One thing to remember, and you guys probably have already experienced this with your clients, is that if the parent is having a fight with the kid to get the product into them, they'll never succeed. So I so deeply appreciate that Systemic has made these taste really good. And I can tell you, with my kids, it's been quite easy. The other oil, I'm a big fan of cycling, so I'll put a family or a teen on one set of oils, and then we'll move to another set. And so I use CBO oil as well. Just always, my general idea is let's always make sure that we're coming at this from as many angles as we possibly can. So use Vista 1 and 2 for a month, then go ahead and use Brainy Play for a month, use CBO oil. Like, really getting the diversity is so important, because the body will never hit a place of homeostasis. It'll always be taking in those as new. So those are the oils that I recommend, especially for brain development. Now, the second thing, and when I gave this talk, this was like mind-bending to parents, is that one of the things people don't realize is that a lot of the behaviors that they're doing with their children, some of them, like medications and things like that, but they are thinking that this is a well-intended idea to give their child medication, and some of the things like eating sugar is causing their child's brain to be deficient in minerals. And I think, honestly, this is one of the most overlooked areas of the growing brain. So what I teach parents is that one of the most important minerals for the brain is magnesium. And in the most simple sense, I think this is, again, simplicity is important, because then you can empower these families to take action from a real inside-out way. But magnesium is the calming mineral. So if you've got a child that is anxious and just can't stop the thoughts from coming, then you're really going to want to look at magnesium as something you want to supplement in. The second mineral that I really encourage people to look at is zinc. So zinc is actually been linked to zinc deficiency has been linked to depression. So I tell parents, if you have a child that's depressed, unmotivated, then we need to look at the possibility that maybe there's a zinc deficiency. And then I go one step further, and I educate them on, okay, let's talk about what is actually depleting your child of these minerals. And I think, the one that the parents battle the most is sugar. I battled that with my family, with my kids, and my kids have grown up in a household that has been talking health since the day they were born. But the minute they go out with their friends, they're around sugar eaters. So what do I do to handle that? I make sure that they're taking a mineral supplement, because I know that I can't completely control their sugar intake. But when you're educating a family, you gotta let them know, if you know you have a sugar eater, then you may have a mineral deficiency in the brain that's not allowing your child's brain to calm down. Stress can also contribute to these mineral deficiencies. Antibiotics, birth control pills, heavy metals, all of that can cause a massive mineral deficiency in the brain. So again, my goal always is empowerment. I don't want my patients to feel like they're dependent upon me. I want them to feel like we're linking arms and that I'm empowering them to take the best care that they possibly can for their children. And one of the things that I feel that parents are so desperately needing is that they walk into these doctor's offices, they're already feeling so low, and then the doctor just continues to give them dead-end answers. So when I prescribe or I recommend supplements, I think that's always helpful, and then I always recommend a food. So I teach them mineral-rich foods, things like wild salmon and nuts and seeds, and leafy greens. Like in our household, whenever we serve a meal, there is always a leafy green on there. If I was really busy at work that day and I couldn't make a salad fast enough, you'll see a half of an avocado on everybody's plate. So making sure that parents are educated and know how to add these mineral-rich foods in. I sprinkle seeds a lot on my salads. And I'm doing it, when I make a salad, I'm like doing it from a perspective of their brain. Put brain octane in the salad dressing, seeds on top of the salad. I even use a little bit of FBR to feed their good bacteria. I'll mix that into my salad dressing. So I try to mask and get as many things into that salad so that when it goes on the plate for my children, that they're getting all of these incredible essential nutrients from as many places as possible. So for me and in my practice, honestly, the magic supplement is Min. We just can never keep that on the shelf enough. It flies off of our shelves. I think Min is probably one of the best mineral supplements that I've ever seen. I've been in practice for 22 years, and what I love about the systemic products is that when you give it to a patient, it works. They see a difference. And if you're teaching them how to avoid the things that are depleting the body, and then you're teaching them how to add stuff in, then now you've got an empowered family. And so they know how to work together as a group to make sure that growing brain is getting what it needs. Zinc is another one, especially if you've got a depressed patient. Okay, third thing. So you've got your fats. So you're gonna teach them about fats, you're gonna teach them about minerals, and then we gotta teach them about antioxidants. So like some of the most amazing antioxidants that often get overlooked for teenagers are B vitamins. So B vitamins, as you guys know, if you just take B12 will help nourish a myelin sheath. And so I show patients like a neuron are two nerves connecting to each other. And they have this protective covering that needs B vitamins, but specifically needs B12 so that those neurons can keep that information firing. So if you've got a kid specifically that's maybe low in, like takes too long to take a test or has trouble focusing, then you want to look at how do you supply or nourish these myelin sheaths. So educate them about B vitamins and how important that is to the nervous system. The other key piece that I'm finding many families don't understand is the importance of things like vitamin D and vitamin E and vitamin C. Like, did you know that vitamin D is so necessary to make neurotransmitters? Neurotransmitters like GABA that calm the brain. So we only think of vitamin D as like, I think mainstream people think of vitamin D as what they need to be taking to prevent cancer. But I'm teaching them that vitamin D is what your kid needs to make sure that they make the neurotransmitters that make them happy, and what they need to make sure that the neurotransmitters are there to create, or that they have neurotransmitters that calm the brain. So again, empower them, educate them. I have found with my patient group, they love that level of education. And how do you get vitamin D? Push them out into the sun. Get them outside. So many kids right now are inside all the time. Get their families hiking. Get them pushing their kids out the door. Get them off the couch. Those kind of things are so powerful for producing more vitamin D and then helping their body produce neurotransmitters. And then a lot of people think of vitamin C for immunity, but they don't realize that the most amount of the part of your brain that requires the most amount of vitamin C is your brain. So again, empowerment and educate. We're back. When we look at the depleters of antioxidants, it's all very similar. It's stress. It's the antibiotic that their pediatrician told them to go on when they had an ear infection way back as a child. It's the birth control that they put their child on to make sure that they don't get pregnant through the teenage years. It's pain medications. If they have an active child, there might be a situation where they're on some kind of, giving them ibuprofen for athletic injuries. And all of that, they have no idea. This is where I think you can become such a powerful resource for your patient base, because they don't have any clue that this is causing a deficiency in the brain. So teach them, educate them, empower them so that they can start to minimize these things and start to maximize the nutrition that's working. One of the strategies I've used with antioxidants is I will tell my patients, when you go, I know at where I'm at, there's Whole Foods. If you go to Whole Foods and you look up above a fruit or vegetable, it will give an ORAC score. So most people don't even know what the ORAC score is. So teach them, show them what that ORAC score is so that they can understand, and show them which ones have the highest ORAC score, like berries. In my household, we have a bowl of berries always out there so that they can, my kids are grabbing berries and nuts. I put it in front of their face so that they see it, because out of sight, out of mind. But when you go, empower your patients and help them understand that when you go to the grocery store has done half the work for you. They put that ORAC score up there. So I give them a list. I hand them a sheet. I say, this is what you're looking for at the store. And then products that I use with almost everybody, but specifically when we're dealing with the teenage brain, is my favorite probably is Moore's. The B vitamins that are in there, the ability to help with the methylation cycle that Moore's has. We just have seen so many transformations happen when we give somebody Moore's. We will do liquid Moore's for little kids, and we can see behavior. Like, I get a lot of kids that are either ADHD or on the autistic spectrum, and liquid Moore's is just magic. You pair that with any of the Vistas, and you're getting the good fat, and then you're improving their methylation, and you're turning off genes. It's incredible. So those are two of my favorite products for anything from 0 all the way up to 18. We have also used Epic to get more nutrients in, antioxidants in. My kids, because of the effect on affecting inflammation, the inflammation cycle, Epic can really have a dramatic effect on that. Any of my athletes, if I've got a family that's very athletic, we will use Epic in that scenario. And then another one that's great to cycle in is Rocks. It is packed with a ton of antioxidants. So you guys already know this. You probably get those patients that just struggle to get their kids to eat well. So lean on these supplements, because they're truly a supplement. They can supplement what the diet is not, the parent is not able to get into the child's diet. Okay, fourth thing, neurotransmitters. So you guys probably already know this, but you've got neurotransmitters like dopamine and serotonin. So those need to be, your body needs to be producing those. GABA is this really crucial one because GABA is what calms the brain. And what I'm finding, especially in these anxious teens, is they just can't calm the brain. They've got that stimulation from social media, from the phone. School has just been giving them more and more and more work. And all of that is causing the brain to rev up. So teaching the family about where neurotransmitters are made becomes crucial. Because people don't, again, we're back like with the minerals, people don't have an clue on what to do around their child's neurotransmitter production. So I teach them that there are 3 areas that can have a dramatic effect on the neurotransmitters. First one, of course, is your gut. So, 80% of serotonin is made in the gut. You got to have the good microbiome in order to produce these neurotransmitters. Second place we look at is the NMDA receptor sites at the base of the brain. So with those of you that are chiropractors, this is where we really, really, really shine. Because when you give a chiropractic adjustment to the upper atlas area, what you're doing is you're stimulating the NMDA receptor sites and causing the brain to calm down. And when you ask your patients how do they feel after an adjustment, many of them will tell you, I feel happier, I feel more at peace. Absolutely true, but educate them that these receptor sites have an influence on excitatory and inhibitory neurotransmitters that are surging through the brain. And then the other place that I educate my patients on is you actually have neurotransmitter receptors in your eye. So I encourage them to get their kids outside, because that sunlight coming in will stimulate, is another way to get some more production of these crucial chemicals in our body. Then we got to go and we got to look again at what is depleting the body. So GMO foods are destroying the gut, so the gut's not producing neurotransmitters anymore. Concussions is another area. Concussions is fascinating because not only is it affecting the neurotransmitter production, especially in the NMDA receptors, but it's creating mineral deficiencies. So things like min are great for concussions. Kids being inside, kids eating bad food, all of that is shutting down the neurotransmitter production in their body. So I first start with empowerment. So I start with get your kids outside. Let's feed your kids some fermented foods. Let's get your kid on a probiotic. Let's get your kid adjusted. We do cold laser work in my office. We start to laser the brain to calm the brain down. But remember, you're dealing with a frustrated parent, and an overwhelmed parent. So what I like to do is give them a lot of options, but then lead them. Here's what I would do for you, Mrs. Jones, is I would start with this, and then I would do this, and then I would do this. Now remember, when they go into the medical doctor's office and they say, my kid's got anxiety, they're getting handed a prescription and maybe told they need to be shipped off to a recovery center. When they come to you and you're like, okay, let's get them outdoors, let's get them adjusted, let's look at their nutrition, let's get them detoxing, like you become the hero of the day. And my personal passion and why I'm so excited to be doing this webinar for you is that what if we all were doing that in our offices, giving people solutions as opposed to people and families crying themselves to sleep and being frustrated. I just think we can change the conversation. So supplements that I've relied on from Systemic, Neurosyn is actually one of my most favorite. I've given Neurosyn to my kids before tests. Before my daughter took the SAT, she got Neurosyn. So I love Neurosyn for focus, especially when you're dealing with teenagers. Calm is great for the anxious teen. I usually recommend they start off by taking it at night because I don't know if it's gonna make them sleepy. I know for me, it does really calm my brain. It gets that GABA production. So it's important to have at night, but I do know that many of my patients use it during the day and have great benefits with it during the day. And then things like B-Brain, get them on B-Brain all the time. Neurosyn and Calm might be as needed, and B-Brain is just great nutrition to make up for what their diet might not be getting. And then, of course, you got to get them on a probiotic. So I cycle probiotics between MBC. MBC is my favorite. If you've got a child with a lot of gut dysbiosis, MBC may be a little difficult at first. It's just so effective, and they might notice some constipation, diarrhea. So I start with ABC, and then I work up to MBC. But both MBC and Min, and probably even Neurocin, are like these 3 supplements I just can't keep on my shelf enough. The minute we order it, it's gone, because people find them so effective. And then the last couple things that I really empower my patients with are healing strategies. Like we do in my family, we just turned our whole front yard into a vegetable garden. And I did that for 2 reasons. One, I wanted more vegetables, but I want to get my hands in dirt as much as possible, and I want to get my kids out with their hands in dirt as much as possible. There are great studies showing that the bacteria of dirt can have an antidepressant effect on the brain. So, we live in this society where we're so focused on cleanliness. If you have patients that have little kids, I'm like, get them outside. With my kids who are more focused on their phones and hanging out with their friends, we try to go on hikes, get out into nature. There's a whole microbiome out there for them to get. There's sunlight for those receptor sites. We do fermented foods like nobody's business in my house. And I'm always trying new stuff. So I'll do things like gut shot and raw kefir waters. And then I make it like fun. I'll be like, hey, you guys, look, I found this new thing. Let's see what you think of it. And just keep the variation of fermented foods working. Bone broth is another option. And you want, if you have kids, you want to make it playful and fun, but then you also want to teach your patients to do that too. The idea is not for us to be like, you have to do it like this, especially when you're doing with teenagers. They will just rebel like nobody's business. But if you do it more in a playful, fun way, like, hey, I just bought this new product, what do you think? The more I've done that with my kids, the more they've come to asking me, what can I do for this? Things like skin. My daughter, when she first started getting bad skin, I knew it was because of food. But when I realized she wanted to clean her skin up, she came to me and said, well, what can I do? So we talked about some of these healing strategies. We got her on things like L-Gut and really worked to look at this from an inside-out perspective. And then, of course, we've got to deal with toxins. With the epidemic of leaky gut causing a leaky brain, you've really got a toxic issue going on in these brains. So I teach my patients that. And we cycle between G-Cell, Bind, Brainy Play, Moors, Cytodetox. All of those get cycled in to my patients. Now, I will tell you as a parent that it's much easier if I give my kid a detox if they notice nothing. If they have a strong detox reaction, I'm not going to get them to take it. Same thing with a parent. If you got a parent that's like not really sure about detoxing the brain, you want to go low and slow. So again, I rely on the liquids quite a bit. So from a nutrition standpoint, that's my army, that's my base, that's my empowerment, that's what I want to educate with. And again, think about this parent who has been given a prescription, or you just gave them this whole like platter of things that they can do. And it just gives them so much hope. So the last thing that I really encourage people, once I show them all the pieces that they need, is that I heard this the other day, and I love this idea, that we don't need universal health care, a universal health care plan. We need a self-care health plan. So I can tell you with my teenage daughter, I teach her self-care all the time. We talk about massages, we talk about meditation, we talk about downtime. I don't look at those things as being a detriment to her when she's taking downtime or if she wants a massage, because I want her to understand that self-care is so important. So you need to educate your patients on that. So a couple things you can do with self-care. First is just sit with them and ask them which of these things that are depleting the brain of the essential nutrients can we help you get rid of. Second, how can we create a strategy for your family? Customize it. People don't want cookie cutter anymore. They want personalized healthcare. So customize it for the family. Then come up with a cycling of supplements. And then I really encourage detoxing for kids, a couple times a year. We do it a lot of times at summer and winter vacation. just because if there is a detox reaction, I've had scenarios where if there is a detox reaction and now the kid's out of school, that's going to be a little tough on the family. And then my love and my passion is chiropractic, and I feel so certain that the chiropractic adjustment has such a profound effect on the brain. We know from Heidi Havoc's research that a chiropractic adjustment stimulates and improves 20 to 30% more blood flow to the prefrontal cortex. And the prefrontal cortex is hope, it's goal setting, it's detail oriented. So when you add that into a family's bag of tricks that they can do to improve their child's brain, it really puts it to a whole new level. And then the second thing is I encourage them that we're a community, that my office is here to support their family. A lot of times with teenagers, they're going to hear it better from us than they're going to hear it from their parents. And you've got exasperated parents. You've got parents that are worn down. So you be the leader. When that kid comes in, don't talk to the parent. Talk to the kid. Empower the kid. Be playful with the kid. Find out what motivates that kid. And when you can make that connection and take the parent out of the picture, you've transformed that family's health. And then the very last thing I'll tell you is that I've used the systemic products to come up with a 3-month detox. And my first month is really about building things up. So I'll get them on a probiotic. I'll start them with ABC. I start with getting them the good fats. So usually I start with one, like Vista 1. I don't want to get too many supplements all at once. So I kind of gauge what the kid is willing to do. I have a few teens in my practice that love the supplements, and I have some that just aren't so excited about that. So I get them doing things like Vista 1, I get them doing ABC. Moors is crucial for starting to get open up the methylation pathways. And then those would probably be my first 3. And then if they're like, yeah, I can take more, I'll add in a mineral supplement, and then at night they can take Calm. So gauge what the family is willing to do, but that's my first month and my first arsenal. The second month, then after that, I will go into working a little bit deeper with getting some antioxidants in. So I'll go to Epic, you could go to Rocks, I'll add that in. I love Neurosin. Neurosin, to me, I see it as more of kind of an upper. So I always start low with Neurosin. I don't always go like, take 2 of these a day. I want to see what kind of reaction the child has first, because it's very stimulating in my mind, and it's incredible for test taking. So those kids that are under a lot of pressure, it just gets the brain focused and those neurotransmitters and the neurons working in such a beautiful way. I do it before talks and before live events, things like that. I just love Neurosin. And then we move them up to MBC. And then after I've taken 2 months of just building up their body, then I'll look at let's start to detox you. I'll always detox with Brainy Play, just keeping those good fats there. Moors, like I said, just to keep those methylation pathways open. And then we'll start with G-Cell or Bind and put those combination together. I find this to be the most effective, especially for teens. My teens that follow that 3-month protocol do amazing. They do incredible. So, and it gives people progress. People love that idea that they're moving forward. And they love the idea that you do one thing 1 month, and then the next month you do something else, and then it feels like progress. And when you feel like you're progressing forward in any aspect of your life, there's going to be a more happiness, more fulfillment. So you want to give that to your families as well. So teen anxiety, that's what I do. Start by changing the paradigm. Teach them about the environment that they're in. Show them, you can take the examples I used with these animals, show them the difference between the environment that their children are growing up in and the environment you and I may have grown up in. Then give them resources, food resources, supplement resources, nature resources. Teach them about that. And then talk to them about detoxing the brain. Talk to them about where they may be vaccines and flu shots and GMO foods and air pollution. Talk to them about all these places that their child's brain may be getting more toxic exposure. and then build a community around them. And I think, if we just did this across every natural, holistic health center across America, I just feel, again, from the bottom of my heart, that we could really, really make an impact on such a growing problem, and that we could really empower these families and start to change the experience our teens are going through. So I hope that helps. And yeah, just don't give up, because these people really need you. Have an awesome day.